Hello, hello.
Hi, Dr. Suzuki.
Hi, Dr. Whyne.
I have a patient to present.
Okay, sure. Let's go.
Okay. So I have Mr. Smith, who's a 45-year-old male. He's following up on his GERD. So he was taking famotidine, having pretty good relief with it. He's been trying to avoid the foods that have been exacerbating his symptoms. He also reports that he rolled his ankle about 2 weeks ago while playing basketball, and he's having some intermittent pain with that. But he's able to ambulate on it well. He walks, but walking on it for a long time makes it worse. And then he also has some upper back pain that he complains about. And he says stretches at home like help the pain and kind of relieve it.
Okay. Has he had any manual therapy or anything before?
So he said he had chiropractic therapy several times in the past that provided some relief on his upper back.
Okay. And what did you find in his structural exams?
So I found some point tenderness at the anterior right ankle, but no swelling or redness or erythema in the area. He had good range of motion. He did have some hypertonicity in his paraspinal muscles bilaterally, T5 through about T7.
Mm-hmm.
Otherwise, the exam was pretty normal.
Okay. What was your greatest dysfunction finding?
Both the back and the ankle are pretty significant, but I think the right ankle probably would be the greatest dysfunction.
Okay. Well, we can re-examine together once again. But why do you think he has like upper back pain?
So I think the right ankle pain is probably coming from the recent sprain that he had when he rolled his ankle when he was playing basketball, and it's healing slowly, and possibly he's been walking on it a lot, so it's been reporting, and he's been reporting that he exercised a lot, so it's probably still exacerbating from it. For the upper back pain, it could be postural, the way he sits. Or when he's driving, but it could also be, I was thinking, viscosomatic reflux from the GERD.
Uh-huh.
Um,
That's actually a really good point. So it could be that too. And then possibly from like a rolling ankle and then postural issues like you mentioned about. So definitely we can double check together too. Okay. That's actually a good point. And what advice are you planning to give it to the patient before you start the OMT if that's indicated?
Yeah, so I think OMT would be indicated. I think it would help him for the ankle. I was kind of thinking about doing counter strain so that it's an indirect technique and not too much for him to exert. And then for the upper back pain, I was thinking about starting also with like a soft tissue myofascial technique, some indirect techniques to kind of get his body introduced to manipulation.
Okay, sounds good. That's a really good plan. So let's go in the room and try to examine him together and try to treat each other, okay?
Okay.
All right.